Oh, wait a minute. Give us a second here, guys. I gotta edit. Here we go. Let's see. We're gonna put this back here. For some reason, the Facebook didn't connect, so I just want to make sure that Facebook connects. So we're gonna restart it here. All right. So bear with me just a moment. Oop. All right. All right. So we should be live. Thank you, audience, for tuning in today. My name is LaSharday Scott. I am the CEO of Scott Center for Observation, Treatment, and Transition. And today, you guys are in for a treat. I have Biba Tinga, who is a mother of 4, with one of them being a sickle cell warrior themselves. And she is also the the executive director president and executive director for the Sickle Cell Disease Association of Canada. So without further ado, Biba, could you please tell the people who you are and how you got involved with sickle cell?
First of all, thank you. Thanks for having me tonight. It's really an honor to be with this impressive lineup of warrior moms and warrior women, right, who are working in our community. Um, so yes, as you said, I'm a warrior mom. I'm a mother of 4, and I have my oldest son has sickle cell disease. I live in Canada currently. It's going to be almost 20 years since we've moved here. But originally, I'm from sub-Saharan Africa, a country called Niger. So how did I get involved with sickle cell? When my son was born over 30 years ago, there was no newborn screening. I did heard about sickle cell, but you know what? You never think like you have it or you can, have a child with sickle cell. So I was a young mom. I was a very young mom. So when my son was born, I just discovered when he was diagnosed he was 7 months old. Just had a crisis, and we went to the clinic. They start treating malaria, and then I realized. And I have to say, at the time, it was a death sentence that was handed to us, right? Because in Africa to this day, children with sickle cell die under the age of 5 because there's still no newborn screening. So their chances of survival is really slim. So from there, the goal was never to be an executive director. The goal was to save that child's life, to be a mom, a good mom for that child. And that's what I've done. And to this day, every decision I make when I always stand in the place of how will this impact positively the life of somebody living with sickle cell? If I don't see any point in it, I don't do it. So here I am. Years forward, we moved to Canada. And then now he's a young adult living with sickle cell. And that's when I think I start stepping out of the family circle, going to, connect with other families and other people. And that's how I became the advocate and the sickle cell. And now the president of SCDAC. I've been in this role since 2017, but we'll talk more about it.
Wow. I can definitely relate to your story. As you know, I am a mother of 2 warriors myself, and I say all the time, we're passion driven. One,
Yeah.
because we're so impacted by it and we're so invested,
Yeah.
because we are trying to set things in place for our own kids, but just, so happily other children, thousands of patients are able to, kind of piggyback off of that, and that's what pushes our mission, I would say.
Mm.
You know, I think a lot of people do not realize the true impact that sickle cell plays on a household. More
Oh,
importantly, the parents, the caregivers,
yes.
right?
Yes.
So with that being said, how have you managed?
Whew. So that's such a good question. So let me start from the beginning. When my son was born, when we were in Niger, there was no internet, there was no patient group, and it was not like the physician will take time to sit and explain even the disease progression to you. I had to educate myself. I had to educate myself and how there was it wasn't like I had a library where I can have tons of books about sickle cell. I went to friends who were in med school in the first, second years, and I read their notes and I asked them, Every time I saw a healthcare provider, I will ask every question. I could, to understand how is this going to happen? What can I do to protect him? And all of them said, well, just if he's sick, rush him to the hospital and make sure, that he's not in pain if you can. And then, anyway, even healthcare provider was saying, anyway, if you're lucky, he might live to get 5 or 15 years old, but not more than that. That's what everybody used to tell me. So how do you manage that? Think about the stress and the anxiety that causes for a mom, and a young mom at the time. And if you don't have resources, limited resources, and also sickle cell disease impacts mostly the mothers, because we are the first primary caregivers, even within families in the household. Because in Canada, for instance, 86% of caregivers are females. The majority of them are females, right? So it impacts your career, it impacts your social life, it impacts your mental health, and it also impacts your ability even to perform if you have a job, because of the stress and all those crises. So how do I do it? I just did whatever I could. I did my best at the beginning with the limited resources that I had. I knew that I had to protect him. So when the physician said he needs an immunization, I'll make sure he gets that. I'll make sure he won't be running under the sun. It's very hot in Niger, 35, 37 degrees. So make sure that, he's always protected, always hydrated. And one of the things that now I realize is that nobody has ever approached me to say, how are you doing? How is your mental health? Never do they think about the moms. Yes, the kids are well taken care of because they need it, right? When you live with a debilitating and painful disease, but nobody talks about the mothers.
Yeah. Yeah.
Nobody talks about us. I've never been offered any type of therapy to support my mental health because I was dealing with the fact that, I have a child that we have to say the reality, might die anytime. Every crisis is a stress where you say, am I going to take this child back home or not?
Yeah.
Every single crisis is a risk for them. So we risk losing them. So I did my best. That's all I can say. I did my best. And when we moved to Canada, actually, that's when I really became a sickle cell advocate, because coming from Africa to North America, I thought maybe, okay, we're going to have access to the best care possible. He's going to be fine. Life is going to be, the best life possible for him and for myself, for the rest of the family. Then I realized that there were so many things missing for sickle cell warriors and their families. Then you have to step up and say, what can I do? How can I change things for us? So did
Yeah.
my best. And here we are.
Listen, you have said so many impactful things just in that short amount of time.
Yeah.
One, I want to reiterate what you just stated. So you said no one has ever asked you, how are you doing?
Yeah.
I said that exact thing. And so, as you know, I work in the line of sickle cell as well. Um,
Mm-hmm.
there's an agency that I work for outside of this, and I actually ran a study assessing PTSD, anxiety, depression among caregivers of sickle cell patients. Now, the numbers did not show what I thought that they would have shown. The
Really?
numbers showed that we in fact do have, it showed that we exemplify or we state that we're going through these things, right? But
Yeah.
I think what's attributed is that in our community, we are perceived to be strong on all counts, right? All,
Yeah.
so a lot of times when you're writing them out, you're like, it's just natural to just get into that drive. Like, I have to advocate for my child. I have to move forward, because we've never been in a position to where we can just say how we truly, truly feel, because society has made us feel that we have to remain strong at all times.
All the time. Yes. All
So
the
the
time.
results did not equate to what I thought, like how we're speaking.
Yeah.
It did not show that. But it was also a small pilot. It wasn't a lot of participants. And it's something I really wanted to make sure that we kind of touched on, because parents especially, caregivers especially, we, I mean, oh my God, even before COVID,
Yeah.
it was just this mindset of you have to protect your child or put your child in this bubble, not necessarily in a bubble, but you're just thinking of all the things that could happen that you don't want to happen. Right?
Yeah. I'm, you know what happened with when the COVID pandemic hit? To this day in my house, no one has had COVID yet. None
Yeah.
of my kids, nobody. Do you know why? Because at it was so easy to just make my young adults sit and explain to them how dangerous the virus was for all of us, but also if their brother,
Yeah.
did catch COVID, it can be really fatal for them, for him. So they were just sitting at home. They did everything. And when the immunization was available, vaccination, they were the first to go in line for the group age and get it because they wanted to protect the brother. So that's when I realized, oh my God, we've been living in COVID mode all our lives.
Yeah.
We've been taking the flu shots. If somebody is sick, you don't come to our house. We don't visit you. So we are really very careful. So it was really easy for us to move into this protective mode when the COVID pandemic hit.
Yep.
But let me tell you something. It also showed me something that was very scary for sickle cell, for people living with sickle cell all over the world globally. In Canada, I know in the US and everywhere, because my son works in the healthcare field. He's a pharmacy technician. And he worked for 60 days. Nobody agreed to even make him stop. They said that COVID was not dangerous for him. His
Wow.
physician wouldn't give him a paper to stop working. Actually, at some point, his boss decided to say, okay, you know what, you have to stay home because we are in contact with the public. And at that time, really, the death rate was so high all over the world. And then I realized, I said, oh, we have so much work to do with sickle cell. There is no evidence-based data. There is not enough research. And when you talk about it, this is one of the things I've been doing in Canada, initiating community-based research. And I tell them, we need to know the impact of the disease on you, on your kids, so that, we can advocate better for you. We need the numbers, because when you go talk to the policymakers, when you talk to anybody to change a policy, to even put new policies in place, you need evidence-based data. And that's what we don't have in this community. We have 10,000 stories of how bad sickle cell is, how it's killing our kids at a very young age. But if you tell them to participate in research, that's when we have a problem. So we have to change that mindset. We need, like, every single patient group should have a registry for sickle cell disease.
Yeah.
Because the registry, like I tell people, why do you think every country has census every 5 years or 10 years or whatever they decide? It's because they need to know the number of the people, in their country, the gender and the quality of life and everything. So we need the same thing so that we can show, when they take this one story and put it online and say somebody was like cured with gene therapy, it's one person out of millions.
Yeah.
And we share it. I get so upset with that. I'm like, we need more research. Let us have those data and show it to them that the quality of life is not there. My son is 35, and I can tell you there is no quality of life. He works, sleeps, and starts over every day. So when are you going to enjoy life?
Yeah. That's a good point. A very good point. I kind of want to circle back
Yeah.
to what we were talking about as far as our impact, right? And I know that as a mom, because you've been doing this a little bit longer than me as far as, raising a child with sickle cell, I guess I just want to know, does it ever seem a little easier? As like, do you ever feel, because let me say this. When I first found out that my son had sickle cell, I instantly went into protective mode.
Yeah.
Even more, it was like an overdrive, right? But I'm just wondering, I think I've letting up a little bit only because of the position I'm in and what that entails. And I understand, allowing them to have, a voice and to make certain decisions on their own. So I get that part now, right?
Yeah.
But as they get older, are your concerns, have they been, a little bit heightened? A little bit more heightened?
You know what? Sickle cell is a chronic debilitating disease. Well, it's a genetic chronic debilitating disease, right?
Mm-hmm.
So unfortunately, what I am gonna say is that at every stage of their life, they can have any complication that they've never had before, that physicians don't even know how to treat. Sometimes, they have to consult other people. So does it really get easier? I don't think so.
Okay.
I don't think so. But I will tell you something though. Um, if we raise them to be independent and to take good care of themselves, it makes it a little bit easier on the caregivers.
Okay.
Right, my son's now, like, I don't take appointment for him. He goes, but listen, he still calls me for a ride every time he has a blood exchange. So I'm still the driver, I'm the cook sometimes, and I'm the social worker sometimes. I tell him, because he talks to me when there is an issue at work, like he feels bad. He was away from a week and colleagues are replacing him, and now he's not feeling well, and I have to talk to him to say, well, I'm sorry, you still have to tell them, you still have to ask for that day off. So it's like different. Let's say, I like to say that my role went from being the caregiver to a consultant in his life, but they need a permanent consultant, because they really need, like, now he uses my experience, my expertise, because I go to more meetings than he does. I talk to people like you, so I always bring back something to say, guess what I learned today. Oh,
Yes.
I went to this webinar. So that's how it changed. But we are losing our kids under the age of 50,
Yes.
right? So that means there is a problem
Yes.
right there. And I see all the young adults around me struggling to keep a steady job, and also struggling to be financially independent. Or, well, our reality is different. Canada and America, healthcare here is public, so you don't have to worry about that. But still, if you want to move out and you have to pay rent, then you need to work. But sickle cell is unpredictable, and it is not recognized as a disability here. So that's one of the things that I I like I don't want to get our government off the hook so easily, to say,
Mm-hmm.
oh yes, but when they grow up, it gets. No, we need more resources, we need more research, we need more support for caregivers. We need our role to be recognized, so that if needs be, we can be supported better.
Yeah.
Many parents have switched, to become to work from themselves, so that they can care for their kids, because they can keep a job. You
Yes.
cannot, and you have to.
Yeah.
So imagine, right, how it can be.
Yeah. And I also have, children that do not have sickle cell. So that's just the two with. But we have a question here. It says, how is the treatment for sickle cell in Canada with the free healthcare?
Well, it's okay. I think physicians are doing their best with the resources that they have, but they always tell us that I have more resources to treat a child with cancer than a child with sickle cell. So in Canada, what we've been left with for the past 40 years is just supportive care. And what do I mean by that? We have hydroxyurea and we have blood transfusion or blood exchange. That's all. Those new drugs that are available since 2017 and 2019, Adakveo and
Cool.
the drug
Spider.
from GBT.
It's
Uh,
Spider.
yes,
Yeah.
brighter. So we don't have them in Canada. They are not available here because of so many reasons, and we are still working on that, advocating. So this one size fits all that we are left with, it's not enough. It's not enough. We need a basket of choices, so that if the hydroxyurea doesn't work for you, blood transfusion has its own risks, right? On long term, iron overload, as we know. So I would say it has its good side to have, the healthcare that we have in Canada. But at the same time, how does it help if you don't have treatment option that can help you with your conditions? How does it help, right?
Yeah. It's always one, you got one service, but not all the goods. And
No,
yeah,
yeah.
it's unfortunate. Um, So yes, we so to go back a little bit even further what we were talking about before, I think having you on this call was like, one, I knew it was definitely needed. But
Yeah.
two, I think it was divine purpose. It's divine purpose behind this because you stated something that I've already researched, and I would love to kind of infiltrate that through the SCDAC there to
Okay.
see what it is, because you talk about research. So my goal is to publish. I don't know if you know, but I'm also a doctoral student. So
Oh,
everything that I do is always wrapped around sickle cell or mental health or something along those lines, but
okay.
predominantly sickle cell. So I'm always trying to find a way to get that research out there. I would love to have it published, but I don't have enough data to
Mm,
be able to, so we talk about the funding. So basically, having that come through, maybe, like I said, come through the SCDAC there, and then
mhm.
kind of get everybody on board so that we have tangible data to be able to say, you know, um, I couldn't keep a job for 2 years because my son was in and out of the hospital. So when you
Yeah.
say, when you talk about stress and mental health and all these things, I
Yeah.
literally, it was really hard, especially for someone like me. I'm very independent and I like to make my own money. But to rely, or to put that stress and pressure on my husband, I just felt like that was just so unfair.
There, yeah.
You know, so that sparked me to go back to school. I utilized my time very well. Let me be very clear. But
Hmm.
it sparked me to go back to school to be able to do some of the things that I'm doing now, to,
Yeah.
to be able to bring that awareness to our community. But I really want us to, once we finish with our call, I really want us to kind of start, pick back on this and get that started. So that we kind of just have numbers, because I would love to see what your population over there is feeling.
Exactly. Guess what? I see room for great collaboration here. And one of our um, uh, objectives always is just to collaborate, advancement through collaboration. There is no need to duplicate, things. If you started something, let's bring it to Canada. Let's work together, get more. The more, data we have, then we can make it, make a global impact also. So yes, there is room for collaboration and we can absolutely do that. We can expand your research to Canada and then see what we can find and then compare maybe both countries and see with the healthcare system you have in America and the one we have, see how it impacts the caregivers, the patients, the quality of life. That would be good to work together.
Absolutely. Absolutely. We were talking, I know Gina Glass, you
Yes.
from Dreamsicle. We were
Yeah.
just talking about this last week. We stated how we all need to be more intentional on
Yeah.
sharing those resources within our community, because we really do a disservice when we're, being very secretive about
Yeah.
what it is that what we have. I truly believe in providing whatever resource I have, because I'm not a stingy person. So so my whole goal is to make sure, that I am providing the knowledge that I have. And then I'm a great student as well. I like
Yeah.
to learn from others. So I feel like if we all have that mindset, there's no reason why the sickle cell community should not be as global as breast cancer.
Thank you. You've
That's
said
that's my
that.
biggest.
Don't get me started about that one. Do you know what? When I grew up in Africa, as I told you, and I grew up in one of, I would say, the like classified as the poorest country in the world by the United Nations, Niger. And when I was growing up, there was no internet, as I said. There was not even TV in some of the places. We didn't have a phone at home. But we knew to advocate against, like, for apartheid to end in South Africa, and for Nelson Mandela, you know, to be freed. How did we get that? Because the entire world was speaking the same language. Everywhere you went, stop apartheid, against people, black people in South Africa, and free Nelson Mandela. just through the radio, but everywhere you went, on every word, we were writing it, people were marching, and it happened, right? Look, he became the president of his country at the end. And then you look at the Greenpeace model. Look at Greenpeace, how everybody knows that they should recycle. Impressive. And you go to Africa, people who are not even educated, they are recycling because Greenpeace was able to take the same message and made it global. Same. That's what we don't have in the sickle cell community. We have 10,000 voices saying 10,000 different things at the same time.
Yep.
So imagine the power, right? Democracy is about number, and we have the number. So how come we're not able to make a significant impact for ourselves? So imagine next June 19, every single organization, every single patient group, every single family, every single advocate stands and say, we need newborn screening globally. Our
Mhm.
policymakers are going to have to align. The World Health Organization, everybody's going to say that, you know what, this community is asking for this one thing. Same voice. If you are in Middle East, North America, Europe, Africa, same ask. We have to be because we are still losing people, at a very young age because we don't have newborn screening. Or let's say we need hydroxyurea to be available everywhere in the world. Whatever it is that is the priority, let's set it together and use one. So that's what we don't have, a strong unified voice.
Mhm.
That's what we don't have in the sickle cell community. And that breaks my heart every time. That's why I always come from a place of allyship and collaboration
Yeah.
all the time. I will never shut the door. Like now, I'm gonna be calling you. We're gonna be sitting with teams. We're gonna work on that research, and we will come back here hopefully and present all our findings together. Because
Yeah.
it's how we can change things for ourselves. And then we use these numbers. You use them in America, I use them in Canada, and we use them anywhere else that somebody can take those numbers and say, look what they are able to show.
Yeah.
When I say I'm struggling, as a woman, when I say that, like, sickle cell even put a strain on my relationship with my husband, because sometimes you just don't have the time to take care of your man because you spend 2 weeks in the hospital, you're tired, you stress, and you just, you have the house, you have other kids. Same thing, same situation. In my career, same time. Sometimes I see this promotion and I look at it, I'm like, this is not realistic. You can't do it, but I have the expertise, I have everything, but I look at my reality, and I'm not going to be able to perform as other colleagues. And then I will take the position, and then I will, it's going to be another disappointment for myself and for people. So then I don't do it. And all this, if we are able to put it in a way that can be presented, evidence-based data, then I think we can change things for ourselves. Just the fact that, as a caregiver, you can have accommodation if you're working,
Yep.
right? So
Yep.
that people understand that, you know what, if you can, now with COVID, we can work from anywhere. Well, if you have to take your laptop when your son is receiving a blood transfusion or has this exam or work maybe different hours, then so be it. But we don't even have that.
Yeah.
We don't even have that.
Yeah. It's really, man, you touched on so many things. I'm sitting over here like, oh my goodness. Yes. I don't know if you've ever experienced this, because I heard you mention something about I heard you mention that even in your relationship with your husband,
Yes.
um I know that I get so deeply rooted. I'm very invested in what it is that I'm trying to convey and put out there, for people to know. And I think because I'm such a compassionate person
Yeah.
and I'm so connected professionally, personally, sometimes it is so hard to
Hard. Yeah.
it's really hard to cut the rope, right?
Yeah.
It's hard because I'll hear something and then I'm emotional by it, about the topic in general. I become very emotional, or I'm passionate about it because I'm like, well, why
And
is this happening? And I have to do something, like it's just in me to like want to help, and sometimes um and granted, my husband has very, very he has very his comments that he's made in regards to, sometimes it's okay just to pull back. You can't do it all by yourself. Like,
Yeah,
but I don't know how to receive
I know. Me
hard.
too.
And I tell him, I said, you just don't, and I mean, I'm crying, like, you don't understand
Yeah,
what it is that I'm feeling, because I'm angry sometimes, because it's like, this should not be happening.
yeah.
When I see videos of patients being mistreated, it's like, okay, now I'm back in advocacy mode. That could be our child.
I
That could
know.
be our child, you know.
I know. I know. And sometimes, I'm tired and I'm not feeling well, and they will tell me, even the kids, Mom, get some rest. Just, stop. Whatever you're doing, stop. When my son told me, he said, if you're doing it for me, please get some rest, stop. Then, but you can't. Then I'm like, it's no longer about you only. It's about all the 6,000 kids in Canada who live with sickle cell disease, because even sitting in the same room has another mom who just got a recent diagnosis, and for me to tell her that there is hope. Look at my son. Yes, there is pain in this journey. Yes, there is a lot of broken dreams. But you know what? If you do the right thing, you're gonna make it. So even that, for me, if that's the only thing I can do in a day, I will still have to do it. I
Yeah.
can just sit back and say no. So yes, you're right. It's so hard. And think about the impact on the siblings.
Yes.
I
Yeah.
was recently talking about that. I said, I don't know any other life because it's my firstborn. So I think I've came as a mom with my trauma, right? Coming from this journey. And I've raised those kids with what I have. That's all I got. That's what I know to be our reality. So I don't know really. I look at them sometimes, I'm like, oh my God, I'm so sorry. And they go, well, no, it's okay.
Yeah.
You
I
know, it's
it's
hard.
crazy because I have a 12-year-old,
Yeah.
and he's such an old man. I love him. I don't know. God has truly blessed me with him. He is something special. Um, when his brothers are sick, he just jumps right into, what do you need? He,
Yeah.
he's such a compassionate and caring person, but I worry about him.
Yes.
But he's worried about us. And
Oh,
I'm like, I talk to him and I'm like, what's going on? Are you okay? I'm good. I'm your mom. I'm supposed to ask you, are
yeah.
you okay? What are the things that are impacting you? And we've had dialogue between him and I, just to see where his mind is and how he feels. But sometimes, honestly, my personal opinion, and I could be wrong, sometimes I think he feels guilty.
Oh, because he doesn't have sickles.
I do.
Oh,
Sometimes I feel that way,
yeah.
and maybe guilty is not the word that I should use, but I think he looks at his brothers. He's
Yeah,
been
he feels bad that they're
yeah,
going through so much, and
yeah, and
that
I
that's
try
not.
to make sure that his dad and I, we really try to make sure that we, get his point of view, make sure that he's okay.
Yeah,
Um, but he's so reserved, and he won't tell you. He really won't tell you.
of
But
course.
as a mom, your mom, when something is just like, what is really going on? Talk to me.
Yeah,
It's okay.
no, I know.
Uh,
I There is, you know what? That's what I tell them. I said, listen, this is our reality. Unfortunately, this is our life. So we don't know any other life, but I've done my best, for them to have a normal childhood. But we've canceled so many birthday parties where they couldn't go. I remember recently when my youngest daughter turned 18, she came with me in the same hospital where their brother used to go when he was um, under 18, and they did some huge renovations, right? And the playroom now has all these electronics, and everything. So we went there, and then quietly she made a comment. She said, I wish they had this when we were coming here. And I'm
mm,
like, what do you mean? And she goes, we spent a lot of time here. There was only books and TV. But now look, they have iPads, they have all this stuff, they have a computer, they have small, and
yeah,
the room is bigger, and they even have like a place where they can even sleep. But we only had chairs. It was really a playroom, not a place where they can relax and lay down and sleep. And they spend hours and hours there, because sometimes I was taking everybody with me because I had nobody to care for them.
yeah,
And that's when I realized, and I look at her. And when she told me she was already 18, But this was happening when she was like from 3 years old to maybe 7 or 8 years old. Imagine.
Yeah.
So the siblings have to be part of that research.
Oh, absolutely.
They have, because we can't leave them behind because they are also part of the care system.
Yeah.
But guess what? I never raised my other kids to be caregivers for their brothers, but I want them to understand that, you know what, he might need support sometimes, and if he comes to them so that they can. But now I'm looking at them; they are all young adults. It's like it just happened, just like that, naturally. They are all like caregivers to him. They know every single thing that has to be done. They are really there for him, and I'm like, well, the goal was not to make you another, an extra caregiver for him, but if he needs it, then, and if you can provide it, why not?
Yeah. And then that's just the power of love and being a family, you know,
Yes,
especially since they've been deeply rooted in that
in that.
context anyway, or that situation. So it's just natural for them to,
Naturally, yeah.
their role. Um,
But the
but
trauma is there, but there is trauma.
yeah, oh yeah,
Oh, there is trauma. They all keep asking me, are you sure about my sickle cell status? I'm like, yeah, I'm sure. You get tested, I know. Because I have one who is an AS trait warrior. So I tell them, you have the trait, but the others do not. So I said, no, that's the most important part. Also education, right? Talking to them and letting them know. So I'm sure, like, they all, my daughter started dating, and one of the first things she said, I asked everybody, do you have sickle cell trait? She
yeah,
goes, Mom, that's the first thing I asked them. Then I said, but you don't have it. She goes, I don't care. I'm still asking them.
um,
I don't care. I'm still asking them. So you see, the job is done there. I'm like, okay, she's aware. She knows.
yeah,
Yeah.
because she's seen it and she sees what sickle cell does, and once again, how it impacts the household. Especially if you said you didn't really have a whole lot of family support. I really it honestly, when I hear that, I think about just sickle cell as a whole, right?
Mm.
How many other people are doing this alone?
Most families are doing it a lot, I think, and I will tell you why. Personally, our situation is because we immigrated to Canada and we don't have direct family here. So I created a network, but they're friends, they're colleagues that became like family to us. But people get tired. People have a life. People sometimes, and that's when the social isolation comes, right?
Yeah.
um, and I realized that recently, because my son is an adult now, I have more time. But then I realized that I don't have a social life,
Mhm.
because for years, if I wasn't taking care of him because he was sick, I was trying to make it up to the other siblings so that they can have a normal childhood. It was just about the kids that for them, for activities, schools, and everything. And when I now that they are all young adults, then I realize, okay, I need to take care of myself. I need to find things that I can do that are not sickle cell related. And I only have maybe two friends, and all we do is shopping together. I'm like, if that's the only thing I can do, I will do it with them. But it's true, because all my life revolves around, if I'm not in a hospital, then I'm like in this event, this conference, I'm preparing for an, like, it's just sickle cell took over our lives.
Yeah.
So I don't know how other parents, but I've been talking to parents with other rare and ultra rare diseases, and that's the same thing.
Mm.
When you have a disease where there is no universal cure, or there are limited treatment options, it's normal that it consumes your life, because you have a human being who is struggling and is part of your family, so you have to care for them, right?
Yeah.
So it is what it is, like, and it's the only thing we know.
Mm.
It is what it is, but that's all we can do.
So, were you involved in any, or was this even an option? Were you involved in any sickle cell support groups prior to your son becoming an adult?
Yes.
Okay.
Yes, so that's how I started, actually, and then after that, I got involved, and in Quebec, when we moved here in Montreal, Quebec. So I think a nurse at the hospital told me, "Oh, you're new here, you don't know anybody." So that's how I met my first friends. It's within the sickle cell community.
Okay.
So and I start going, networking and talking to these parents to say, but guess what? Thanks to my son, we initiated the first young adult support group in Quebec. Because when he turned, he become, I think he was 18 and over. And at some point, I was taking him with me to some of the activities. And then he goes, well, it's not for me. I don't find what I'm looking for there. So this is for mommies. So, and I'm like, well, what do you mean? He goes, well, I need to talk to people my age and we can share, live experience and tips and everything. So I talked to the Quebec president, and that's how we start, bringing them together to have, and we initiated the first in-person support group, and it's still going on now. He goes from time to time, but I think that's one of the most important things every sickle cell group needs to have. The peer support, it's important, especially because of the transition period. That is one of the um, most difficult and dangerous for them,
Yeah.
for the young adults, because parents tend to, well, I think there is no proper transition programs in most institutions, so they are not well prepared to
Yep.
care for themselves, and parents will assume, okay, now he's over 18, I don't have to be present, and that's when they start skipping appointments or not doing the right thing. And I don't know for the US, but in Canada, that's within that age 17 to 25 that we lose, our young adults here.
And yes, it's around that same age here. That's kind of how my nonprofit came about. I wanted to make sure that I had something set in place, especially here in the
Good.
Toledo area, um, for patients transitioning from pediatric to adult care. Because there's so many intricate pieces to transitioning that I don't think people even understand that. We know transition of healthcare, but
Yeah.
then you also have the education piece, the family piece, there's so many different
Yeah.
levels of transitioning that we're not even speaking on. And one, what you just stated, you know, the appointments, these things really start. We should really be starting these children, to me, at the point of where they're able to ask for something, in my
Yeah.
opinion, for
No,
the
it's
bare minimum. My two warriors are 8 and soon to be 7,
okay.
and they know their medications. They know.
Good. Good job, Mama.
But as mom and dad, we be on them. We really do. But they have the responsibility of going to get their medication at a certain time.
Yeah.
They know it's 6 o'clock at night. You better take your Expida, your hydroxyurea, your elderberry, your vitamins, because these are the things that are going to keep you out of the hospital.
Yes.
And I'm not trying to be there if I don't need to,
Yeah.
and that's literally the conversations that, dad and I have with them. I'm not trying to sit in the hospital. Are you? Do you like being in pain? So it's really holding them accountable, but then that will follow them through
I
because,
love that. I love that word, accountability. Tell them. Also, it's about them being responsible for their own care, because if you don't get that collaboration from them, it's gonna hurt them on the long run.
yeah,
So you're starting at the right time, getting them to know what to do for themselves. I even told my son when he started, like he was 15, 16, I said to him, listen, when you are with your friends, I want you to be selfish. He was looking at me, why will I said, because you are different. So
yeah,
if you're tired, you need to be able to tell them, I gotta go home. I can't stay with you guys. I'm tired. Or if you're cold, guys, I can't stay in this room. It's too cold. Like you have to be able to express your needs clearly and to get them to listen to you,
yeah,
because that's what they do, right? Everybody is not wearing a jacket, then they're gonna go walk outside. Canada is minus 30 sometimes. So I had to teach him. I said, if you're hungry, you have to be able to voices to tell people you need to take your medication. Tell them that you can't afford, to just let to I don't like to say to act like everybody else, but you have to take better care of yourself so that people will know that it's important for them to care for you. And if you are with them, then they know also what to do.
yeah,
I
yeah,
told my son, your friends need to know what to do. They don't play with you. If you're not feeling well, they have to call an ambulance if they cannot drive you home, or call me. So I was friends with all his friends. I had their numbers.
mhm,
The minute he introduced a friend, I take the cell phone number. He used to, don't do that thing that you do. I'm like, no, I'm not going to call them, but you never know. So one day they might need to call me to come and pick you up, or something happened. They can call me, and I will tell them, call an ambulance. And it did happen
Mm.
where he was with friends, and they had to call ambulance for him. So because they knew exactly, they said, we don't want to take any risk. Your mom said to call an ambulance. We're going to do that. So that also comes with, educating them, educating him, so that
Yeah.
he can educate people around him better. So that's a good thing to do. And to get back to the support group, that's what the support group also can provide to the parents who
Yeah.
has a child to learn how to do it, right? And also for the young adults. So we need both.
Yeah. And I want to touch on that since I have you. So,
Yeah.
yours, if you are watching, you do not have to have sickle cell to be a part of these support groups. We need people that are on the outside to
Yeah.
help, help spread that advocacy or get involved. Our champions, sometimes they are not at their best.
Hmm.
So therefore they need people who, one, respect them,
Hmm.
two, feel that compassion and want to help in that regard of, making sure that the advocacy is out there. And
Yeah.
then more importantly, it's just nice for them to have somebody to turn to, you know, um, outside of, the sickle cell community, because I
Yeah.
think sometimes we miss that piece, overall, what these patients are dealing with.
Yeah. Yeah.
They've been dealing with this from the moment they came into this world.
Absolutely. And it's a lot.
Yes.
It's a lot to live with that, the pain. And also, so there is something that really bothers me with the healthcare providers. So when a child is young, like your kids now, you will see how when they're in crisis or when they have those hospital visits, everybody, the nurses, the physicians, everybody is working really to make sure that the child is okay, that they get the best care possible. But that same child becomes an adult, and then they're scared of that child, and then that child becomes a drug seeker.
Yeah.
And I told them, I said, do not use the word addiction with my son. He's not. He's dependent on the treatment that you use to control his pain.
Yeah.
And he didn't buy it on the street. You prescribe it. So we have to advocate for them, for that respect, to remove that stigma. So
Yeah.
that's why we need the allies, the friends, the colleagues, the partners, people in the community. If they know, sometimes if that person cannot speak for themselves, you can stand and say, do not treat them like that.
Yeah.
You
So
know?
that goes back to perceived, you know, perceived how medical professionals perceive, one, black men, black women.
Yeah.
We have tougher skin, we're strong, we're this. But the reality is, as you stated before, if they're starting patients on opiates as children,
Children, yes. So
what is going to happen
when they
when
become,
they become adults? It's mind blowing. You would think, now these are medical professionals, they've done all this schooling. You would
yeah,
think they have a clear understanding, but
no,
no.
no,
Um, yes, so an audience member said, wow, that is something I keep hearing in this community.
yes,
The difference of care between the children and adult. Yes, it is real.
it's
It
real.
is
Yeah,
real.
it
Um,
is.
and I'm gonna keep talking about it,
So we have to.
until somebody does something about it.
We
They
have to raise awareness about it, and the only way is to talk about it and to share, those stories, and then to be a voice for the voiceless, for the patients when they cannot speak for themselves. Um, Last year, my son had surgery, and so he was in the hospital for a night. And then they called me and said, okay, so he's going home today. Come and pick him up. He's an adult, right?
Yeah,
So, but I said, because you've had surgery, you're gonna come to my house to recover, and then then you can go back to your house. So I get to the hospital to pick him up, and we have this male nurse who was very friendly, very nice. I find them having a nice conversation about, how everything went well, but be careful for the next week and everything. So as we was about to leave, he said to him, okay, you're leaving soon. So the doctor has prescribed some Dilaudid for you, which is an opioid. But if you tell me that you're not in pain, I'm not going to give it to you. I'm going to give you Tylenol. But right before that, I was just sitting and looking at them, and he said to him, I don't know where you live. Mom is going to drive you. Is it far? And do you have stairs to climb? So he was asking me, so you might be in a little bit of pain today when you get into your bed, but with the medication that you have, it will just be okay. But then he turns and say, I'm not going to give it to you. I will give you Tylenol. So I look at my son. He was just calm, did not react, did not even, had no reaction to that. But right away, the advocate in me was so upset.
Yeah.
So I asked him, I said, so if the doctor prescribed something for him because they said that he might be in pain by the time he leaves the hospital, walk to my car and goes home, why aren't you giving it to him? Oh, well, we don't like to give this. And I'm like, are you saying that because he has sickle cell? If
Right.
he didn't have sickle cell, if it was like, Mr. Everybody who just had one surgery in their lifetime, so would you give him that to say, oh, you're going to be in so much pain, so I got to give you this so that, you can travel home safely? So I said, give it to him. Then he turns to me and said, well, you're not the patient. I turned to my son, I said, request the medication. He did. He gave it to him. When we got in the car, then I asked him, I said, well, why didn't you react? Why didn't you speak up? And he looked at me. He said, I just had surgery, Mom. I'm picking my battles. Not today.
Mm.
He said, I got a prescription, by the way. I was going to tell you to pass by the pharmacy to get it. I was like, no, that's what you shouldn't do. You should speak up every time. He goes, not today, Mom, not today. So imagine if I wasn't there, that young man was going to live with that frustration of being denied a simple one pill and giving Tylenol that will not ease his pain, and he will get home, and that can even trigger a crisis in his case.
Absolutely.
The fact that he has sickle cell. So I was so upset. I wrote it. I was talking about it for weeks. I called the hospital. I wrote to the doctors. I said, that's not okay. You
Yeah.
cannot treat them like that. I
Yeah.
was there, and I happened to be his mother, and I happened to be a health advocate. Another mom who doesn't know, what will she do? She will just say, okay, if the nurse says you don't need it, then let's go home. But then at night, she might come back for a crisis, or maybe see her child in pain. So that's what our community has been going through for so many years, and I don't see anything changing it unless we speak up as
Yeah.
a community, unless we stand against it, unless we call people on it when they're doing it, we stop it, we educate them. And that's what every single parent, every single patient should be doing, and every single advocate.
Absolutely. And you made the statement before that you got 10,000 people saying 10,000 different messages, right?
Yes.
We have to come together to create one
Priority list.
unified voice to be able to target these problems.
Yes.
Um, I really enjoy. I know you were probably on that call too. The policy forum that
Sickle
Tuesday.
Cell Consortium, and no, unfortunately, I couldn't attend that one.
Oh, okay.
And Sickle Cell Association of America, the one they did in collaboration, right?
Yes,
Yeah.
that was really good. It was actually my first time ever attending, and it was really nice to see and have these conversations with legislators to tell them our thought process behind it and
Yeah.
what things they should be looking out for, all of these things. So I have Daniel here saying yes, we have to keep speaking up. We do. I talk about it every every time I can. I know people probably get tired of me, but I really don't care.
Oh, no, 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 no. You know what? You're doing what you're supposed to do. Keep talking about it. Keep
Yes.
raising your voice anytime you get the opportunity. And that's why we need standards of care everywhere.
Yeah.
We need standards of care, and we need to make sure that they use them, they apply them in every single institution where they treat sickle cell patient. And if they do not, we need to call them.
Yes.
It sounds like the nurse wanted the prescription for himself. Barbara. Well, I don't know, but it was just it was really I was really upset. that it was not okay. And so if I wasn't there, maybe he was going to let it go and then be again a victim of it over and over again. And I said, no, speak up, refuse. If it's prescribed, say, I need it, take
Yep.
it. Because
Yeah.
otherwise they're going to do it to somebody else to say, oh, if he's able to go home after a surgery without any painkiller, then you too can do it. So that's when they would say, well, black people are strong, they can take more pain than others. I said, no, if it's prescribed, take it. If you
Yep.
don't, keep it, but take it.
Yep.
Take
Yep.
it as prescribed by the physicians. So don't try to be strong, or don't try to say, oh, I'm going to go on my own and get it at the pharmacy. Why will you do that to yourself?
Yes.
So, um, and then there is something that you were also talking about. We need to have that strong, unified voice. I
Yes.
must tell you that there is a global organization for sickle cell disease. It's been GASCDO, which actually my Canada is a member of it, and I sit on the board of director, and that's exactly that statement I made about Greenpeace and apartheid in Africa. I always repeat it over and over again until our community understands that, until we come together as one, let's say all the organization works and we have this priority list. I know we are not at the same level, right? For example, we can't even compare America to Canada. You have drugs that we don't have, but you can't also compare an African country to a Middle East country. But still, there are so many things that we have in common that we can work on to say, okay, hydroxyurea is going to be available for you no matter where you live in the world. It's the cheapest drug now, right? It
Yeah.
costs about $1 a day. So even less in some countries. And like also advocate for blood donation from the Black community. Guess
Yes.
what? One of the community-based research that I initiated here with some partners in Canada, we found out that there was some those sociocultural beliefs that make people are not even trying to donate,
Mm.
because for years, when they go, they've been, deferred because of the malaria, deferral, iron deferral, and racism, also systemic barriers. So people are not even trying. Because I keep wondering, how come in Canada, the donor base has less than 1% people identifying as Black?
Mm.
Like, we are a community that likes to help each other. You go into a church, a mosque, a community event, you talk about it, people really wants to help and they are not donating blood. So there is some work to do, education to do globally, to tell every single person who can donate blood, if you identify as Black, you should be donating blood. You should be a blood champion, because that's the only treatment option for some people in some part of the world. It's
Yeah.
just blood, even in Canada. Like, my son has been on blood exchange for the past 10 years, every 7 weeks. That's all that's available for him for now. So there are so many things we have in common that we can work on, have this list of global priorities, and everybody can work maybe in their own countries on those other issues that are, particular to them. But we can do so much if we are united and we work together.
Absolutely. And that pretty much ties into what our viewer said. The more you speak up, the more people become informed. And that's
Yes.
true. Um, I definitely feel like we are walking in our purpose. Just constantly putting the information out there. I try to tell our community all the time, 1 out of 13 of your friends have sickle cell trait.
Yes.
And
Yes.
that you might not even know because nobody's sharing that information. We are so hush hush in our community about different diagnoses.
Yeah.
And really, we're doing a disservice. And I say this every talk I do. We have to be informed on the things that impact our community, especially sickle cell, because it's the numbers are there. They don't lie. The numbers
Yeah.
are there. Um, and like I said, I too was guilty at one point. I never took an interest in. I knew I had trait my whole life. I never took as much interest into sickle cell until it truly impacted my household. I have to be transparent on that. But
Hmm.
I say all that to say, don't be like me. Be better, and become informed on what impacts our community.
It's
And
true. It's true.
yeah, we just have to make sure that we're putting that message out there and continue to put that message out there so that we can lessen the numbers on sickle cell disease.
So true, Rashada. One of the things that you and I, maybe it's part of our purpose, our mission in this world to do, is like having those children in our lives allow us to sit in a position where we can tell people what it is to raise sickle cell, what it is to deal with the disease, has a family, has a caregiver, and to also educate the younger generation for them to make informed decision by knowing the sickle cell status and then deciding when comes time to have children. Because it's not that I think every child is a blessing, right? My son is one of the most beautiful things that has happened to me. And let me tell you something. He is the firstborn, but the gift that he's brought in our lives is that he's been a motivation for his siblings to do good.
Yeah.
So that's even I'm like, okay, so then maybe that's his mission on earth, to pull those one, and whatever he couldn't do, he will tell them, you need to go to college, you need to get a degree, you need to get a PhD, you need to go further, you need to get this job. I couldn't get those jobs that are too physical sometimes because I was sick, because my back hurts and something like that. So I think we have to do that. We have the way you are talking today, that's always what I've been telling people. I don't understand how 100,000 babies a year are born in the world. And then the World Health Organization is predicting that we're going to have millions of people again living with sickle cell disease if we have so many ways, to prevent it. That means our community is not listening. They
Yeah.
are not listening, right?
Yeah.
So our lived experience, exactly, our lived experience are the best educational tool we have at our disposal, and that's why I share my story. That's why I tell people I sit in a place where I have had so many broken dreams in my life, as
Yeah.
a woman, as a mom, and also I've seen my son have so many broken dreams that I don't want anybody to go through that. If sharing our stories can help people avoid it, then that's what we'll do.
Absolutely. I just want to say I thank you for coming on here today. I've always heard great things about you.
Oh, thank you.
And anybody that knows me know I use my social media to network, meet people that are doing the things that I'm doing or better than me, so that I can learn from that individual and see how, I can infiltrate some of those things here where I currently reside.
Yeah,
So you agreeing to come on here, I appreciate you. You are awesome.
you
Um,
too.
your children are lucky to have you. I definitely will be reaching out so that we can get
Oh,
that
yes.
going. Because I'm really, really, I mean, I know the passion is there with you. So it's really nice to be able to work with someone who kind of visualize the same things that I'm visualizing and want to see those things in the community. So before we leave, I
Yeah.
want to make sure I get, so is your at handle like is it SCDAC?
Yes.
Okay, so I'm gonna go ahead.
Yes.
You guys can follow Miss Biba Tinga. Is that Instagram?
Yes. Instagram. Oh, Instagram is ACDAC.AAFC. That's the French, because
Oh,
Canada, we are bilingual.
let me
So,
go in here and edit it. Hold on.
yes,
I want to make
ACDAC.AAFC.
so SCDA dot
AAFC.
AAFC.
Yeah. You can
SCS.
also find, yes, ACDAC.AAFC. And they can find me also on Instagram. I think you tagged me today, so you have my Instagram, Sokhna Biba.
I feel like I didn't do it right. Hold on, I'm acting crazy here. So it's a SCDA.
SCDAC
Okay. Dot
AAFC.
FC. Okay, I'm gonna put it here. I had a crazy moment. I couldn't get it out. Is that right? Boom.
Perfect.
So I want you guys to follow her. She is amazing. She is doing some great things over there in Canada.
Thanks.
Like I said, I really, really appreciate you. We got some people. Oh, they sent
Oh,
fire. Said glad to see you on here. Yeah.
Serena. Hi. Serena is my fellow Canadian. She's an advocate, warrior. Hi, Serena.
We had some other stuff.
Oh, cool. Oh my God. I have all my warrior's mom. She's a warrior mom also.
Yes. So
Just like you. She has
I'm
two.
really happy that you came today. Once again, audience, Biba Tinga at SCDAC.AAFC, even though it took me 4 times to figure out what was. But I appreciate you. You guys do not want to miss next week. So, in closing, for Women's Month and Social Work Month, my mentee, who is a sickle cell warrior, now social worker, Chelsea Parker, she will be on here next Friday at 6 o'clock and at 6 p.m. Eastern Standard Time. And then be looking for the Minority Health Month for April. We have a list. Did you see the list?
I saw it.
We have heavy hitters on there. You guys
I'll be watching.
yes, I will appreciate it. And you and I, like I said, we will link up. I will be you just hold off. I'm gonna go ahead and end this and we're gonna switch contact numbers.
Okay.
Audience, we appreciate you guys tuning in.
Thanks everyone.